everyone, back
Hey,
at you
guys.
again.
Even though it looks like we're in a bunker underground right now,
No need to panic.
no need to panic.
We are
Things
not
are going
underground.
okay.
We're just in our other location today.
Yes, an undisclosed location, but it's safe. Everybody's fine. No need to
doing
worry.
okay. So week 2, down with week 2, and hopefully not too many more to go, but probably a decent amount of more weeks to go.
Probably. We've screened over 200 people already. We've tested, and we've had about, I think, 23 positive for coronavirus.
So at first I thought, oh my gosh, that's a high positive percentage, but we talked about it and decided that it means it's good if we are having a high positive percentage when we test people, because we're probably screening them appropriately and only bringing in the people that really need to be tested.
Right. Yeah, the higher risk people are the ones that are coming in. I think there have been a lot of people that we've assumed have been positive, but they've been stable, so we've told them to wait at home.
So some new questions this week from some people were, can you get the coronavirus a second time?
Great question, and the short answer is we don't know. The hope is that once you get exposed, you develop antibodies to the infection, and when you develop antibodies, then presumably you can't get it again. So that remains to be seen right now.
And talking about antibodies, there is maybe going to become some kind of antibody testing.
There is, yeah. So they're working on a blood test, and that blood test is going to tell us if you had that infection. So anyone that we know that had coronavirus, we'd want to test them, but anyone that's been sick over the season, it'd be reasonable to test them just to see how many people have actually been exposed.
Right, because a lot of the numbers in the news right now say how many people are positive, but there are so many people that are not even being tested.
Yeah, and the United States is number 1 now in cases. Not so great, but
Not great.
we kind of expected that. I mean, we have a large country. We weren't really testing that much early on. Now we're doing a lot more testing, and I think those numbers are going to go up. But again, we expect that. So even though you start seeing, United States has the most cases, that doesn't really change anything that we've been seeing so far.
And remember, just because we're not testing everybody and our numbers are probably higher, that also doesn't mean it's scarier, because the mortality rate isn't higher. So
Right.
there are probably a lot more positive people out there making a full recovery, doing okay.
Absolutely. In fact, the mortality rate, it started out initially around 3.5%, 4%, but now in the United States it's more like 1.5%, and I think it's probably going to go even lower.
So that's great news.
That's good.
Yeah.
Yeah.
Good. Some other things we've talked about, if you call in and you do seem to be positive but we don't test you, a lot of people are concerned about that. They just want to know whether they're positive or negative. And we've done a lot of counseling to say, what difference does it make? You should really assume that anyone and everyone around you can be positive.
Right. Yeah, we've had, so I think a common scenario, a spouse that maybe tested positive, and then the other members of the family are starting to show symptoms. We say, we assume that you're positive, and if you're stable, you can recover at home. By doing a test and knowing that you're positive, it's not going to really change anything. There are a couple of scenarios where we really do want to test. If we have a patient who has asthma or COPD, and they're showing signs and symptoms of coronavirus, we would want to know whether they're positive or negative, mainly because one of the treatments is steroids for asthma and COPD. And what we know with coronavirus is that can actually make, if you give those patients steroids, that can actually make them worse. So we'd want to know whether they're positive or negative
Before we treat them.
Yeah.
We've spoken with some people who were either not tested at their local hospital or did test negative, but are overall not feeling better, not sick enough to stay in the hospital, but not really well enough to stay at home without seeing a doctor. So we want to encourage those people to know that they can come and see us in the office.
Absolutely. Part of the screening that we do is we want to make sure, number one, that you don't have coronavirus. If we've ruled that out, but you're still not feeling well, then we can see you in the office. We want to examine you, make sure that your oxygen levels are normal, make sure that your lung exam is normal. There are other tests that we can do, blood tests in the office. So sometimes we will screen patients who've had already flu and strep testing with their other doctors and they're still not feeling better. They come back with a coronavirus that's negative. That's somebody that might have something else going on.
Right, and we can definitely see those patients in the office.
Yes.
Another question, things are constantly changing, so definitely stay tuned every week. But one thing we used to think was not true was that you could have coronavirus and the flu at the same time. We thought that was a pretty low likelihood.
Right.
We have since found out that that's not true. You can have the flu and the virus at the same time.
Yeah, we've had several cases. I think there's a study in Harvard, I believe, that said that the co-infection rate...
Maybe Stanford.
Well, one of the coasts, that the co-infection rate can reach 20%. I think the cases that we've seen have actually been healthcare workers, so they've had flu and coronavirus. So that's why we're testing for both most of the time, just to see how likely that is. There.
We received a lot of donations from friendly neighbors that donated masks, gloves, any PPE that they had, hats. People sewed us some facial masks.
Star Wars masks.
Yeah, or some head bonnets that we could wear. So we really just wanted to say thank you so much for all of your donations.
Thank you very much.
Present too. Yay! Open it. I'm so excited. I can't stand it. So sad. Oh.
Final thing that I wanted to say is, we talked about mortality going down. So some people might assume, well, okay, so this virus is maybe not as bad as we thought, but the issue still remains that a significant portion of patients can still get sick enough that they need to go to the hospital and they need a ventilator. And if we have a huge influx of patients at the same time that get really sick and they need a ventilator, that's what we're worried about. That's why we talk about flattening the curve. We want to have people exposed over a long period of time, not a huge influx of patients, and then all of the ICUs and the hospitals get overwhelmed.
So flattening the curve really means that the same amount of people might still get sick and will probably get sick, but they get sick over a longer period of time instead of all at the same time. They get sick gradually, and the hospital can still maintain taking care of those sick patients without a big surge of patients at the same time.
Exactly. Yep.
All right, awesome. Take care, everybody. Hey there, how's it going?